Hello, and welcome to the first action alert for 2017. My name is Lisa Rosignol, and I'm the healthcare liaison here at Parents Reaching Out. It's a new year with lots of opportunities for you to have an impact on New Mexico health policy. Today our topic is public comment, a very important way that your voice can contribute to healthcare, and something that's often left to only 2 or 3 of us who are paid advocates. The Human Services Division, HSD, that's the state agency that oversees our Medicaid and waiver programs, has to have public comment, and it's federally mandated or required whenever they want to make changes to our benefits or when they want to renew one of our Medicaid waivers. HSD has to prove to the Centers for Medicaid and Medicare, CMS, that they tried really hard to let the public know what they're planning to do and that they addressed concerns from New Mexicans. HSD typically asks for public input in 3 ways. The first is by hosting committees made up of people who represent groups such as Parents Reaching Out, Disability Rights New Mexico, ARC of New Mexico, and so on. Next, they advertise and hold public forums where people can go and stand up in front of a crowd and give their public comments. They may hold these forums around the state, but they are often in Santa Fe during regular business hours on weekdays. And the final strategy they use in public comment is the internet. They place a link on HSD website in hopes that people will click on it and submit their ideas. There are currently 2 very important public comment periods happening. This video will cover the renewal of the Developmental Disabilities Waiver, or DD waiver, which is what is called a 1915 Medicaid Part C Home and Community-Based Services Waiver. There is a public forum on February 1st from 10 a.m. to 1 p.m. at the Toney Anaya building in Santa Fe. The link for comment is on the HSD website, which you can find in the video description below, or you can call HSD and they can mail you a comment form. We encourage those of you on the waiver who have a loved one on this waiver, and even those 6,300 New Mexicans on the wait list, to let HSD know your ideas for the renewal. One mom is working hard to make sure that fetal alcohol spectrum disorder, also known as fetal alcohol syndrome, is included as a covered condition for the waiver. Another group is asking that the renewal address inadequate therapists in certain parts of New Mexico. The pay is not enough to keep providers in rural and frontier communities. You're welcome to use these ideas or can click on the ACT NM link in the description and read through the PowerPoint provided by the Developmental Disabilities Supports Division. You may want to ask that they address the 10 to 15-year wait list and a plan to get people off that list and into services quicker. Finally, you can also use this as an opportunity to spotlight what is working with the DD waiver. What do they need to keep in place? What is working and what has helped most? If you do not have internet access or need assistance, you can call me, Lisa, at Parents Reaching Out, and I can help you submit your online comments. If you would like to attend the February 1 forum in Santa Fe, you can give me a call and I can help you prepare your comments. Let's work together to let HSD know what we think about the DD waiver. Thanks, and we'll see you next time.